Moving on to our next question. This is a question that I hear a lot in the community from my family and friends as well. The only place I see cases going up is in the news. I still don't know really anyone who has the coronavirus. I don't know, I'm just having a hard time understanding that the cases are going up and putting a strain on hospitals because I just don't see it. Where are these numbers coming from?
Sure.
Yeah.
Yeah. So it's a good question. So the numbers tend to come from state level public health organizations. So here in Colorado, that would be the Colorado Department of Public Health and Environment. That's primarily where our numbers are going to come from, and then the equivalent type of agency across all 50 states. Typically, you would see a lot of numbers also coming from the CDC. There's a lot happening at CDC right now, and I know a lot of people have been thinking about it, and I won't go into it, but that's typically where you'll see those numbers come from. So now, where do the state agencies get those numbers from? It's a collective effort across basically all the providers in the state, and especially people who are test manufacturers and or at the very least just administering tests. There are basically cooperative efforts, cooperative partnerships that have been established where entities who are administering the tests then report out at the end of every day up to CDPHE, and CDPHE then basically aggregates all of the data and reports it out. That makes it sound really simple, but it's not, because there are a lot of people that are administering tests, for example. And then in addition to that, you're seeing hospitalization numbers creep up. So obviously it's places like Walgreens, it's places like the hospitals, it's places like urgent care centers, it's places like your primary care providers. There are a lot of just walk-up clinics that are kind of pop-ups. They're just tents and aren't necessarily affiliated with like Walgreens, but they might be affiliated with a specific practice or something. And so you have a lot of data that's kind of sprinkled all over the place, and it all has to be reported up to the state. Sometimes you'll see lags, or it almost looks like things are speeding up one day and then slowing down another day. The reason is because you might have reporting lags as people are trying to basically coalesce everything that they have in order to report up. And so especially around the weekends, for example, you'll see a lot of numbers that just look a lot lower, and so it looks like really good news, which typically is good, but we know that there are reporting lags, especially on the weekends. And so it's just kind of this cooperative effort between a lot of different people in order to get a good handle on kind of where our numbers are at. And then those numbers regionally too, they break down, and so you might even have underneath CDPHE, you could even go to your county public health website. So for example, Tri-County website, they've got a lot of information about what's going on with COVID within the Tri-County area. Denver Department of Public Health and Environment has the same thing. And so you can find kind of more granular information, and CDPHE has a great website where you can basically play around with all of the data that they have up on their COVID website and web page. But if you've got like specific questions, I highly recommend going to a county level public health organization in order to like start digging down into some of those numbers.
Yeah, I always try, just like with politics, I always try with a question like this, I try to localize it as much as possible, just like Katie was doing. And yeah, I know I've had people ask me this very question, like, I don't know anybody that's actually had this or been sick or whatever. When you look at just Colorado, first, we've had probably 160,000+ cases, but we've had about 2,500-ish people die of COVID here in Colorado. But then you dig a little deeper, who are these people? And first, the thing that just jumps out, like Katie was alluding to, when you look at the data, 75% of the people who have died from this are over the age of 70. And when you look a little bit deeper, you see that there are people who have very specific risk factors that, interestingly, male a little bit more than female are dying. African American, a little higher prevalence than the population would drive. Then there are folks with medical conditions, be cancer, COPD, which is a lung disease, obesity above a certain amount, type 2 diabetes. I mean, there's a lot of things like this that are also going to put you at high risk. So my answer to the person's question is, if your circle of contacts do not include a lot of people like that, there's less likelihood that you're probably going to be as aware. But some of the congregate settings around the state, when we say congregate, people who live together, nursing home settings, assisted living, Department of Corrections, jails, etc., these places have seen an extraordinarily high number. North Dakota, as a state right now, 1 out of every 1,500 people in the state is in the hospital right now. 1 out of every 1,500 is in the hospital. There's been rapid explosion through meat packing or meat processing plants. Again, people in close quarters, et cetera. So again, if your circle of, your sphere of contact does not include those kind of things, it's likely you just may not hear about them as much, because that's where this disease seems to be attacking the most.